Cancer treatment in general is multidisciplinary. We mean that it's a combination of treatments that we use in order. The second thing that I would recommend for boost one's mental health during breast cancer treatment is, like, while we're diagnosing the disease, we do the biopsy and all. We also do an ultrasound, a PET CT, and also look at the. So if you want to cure a patient of breast cancer, while other treatments are also required, it's only when you.
Dr. Manjula, hi. Back again for the second episode.
Hi, Rashmi.
So, I want to understand what is the best treatment for breast cancer. What are the various options available? Are there options, or is it customized to a need of a patient, or how does it work?
It's a combination of everything. So it's interesting you should say what is the best treatment available. And I would say there is no one best treatment available. Cancer treatment in general is multidisciplinary. So by multidisciplinary, we mean that it's a combination of treatments that we use in order to cure the patient of cancer. So breast cancer, if you see, is a combination of surgery, chemotherapy, and radiation therapy. There's also something called hormonal therapy, which certain patients may require. But amongst all these patients, like certain patients come to me and they say, Madam, can we just avoid surgery? Can we avoid chemotherapy? Now, can you avoid certain treatments really depends on the kind of disease that they have. And surgery, however, if we tell you that, madam, you require surgery, that's a good thing because surgery is curative for breast cancer. So if you want to cure a patient of breast cancer, while other treatments are also required, it's only when you operate and take out that diseased area will the woman be free of breast cancer, right? So it is multidisciplinary. And now, like you said, how do we decide which patient gets what? So that depends on the kind of cancer that they have. So how do we find that out? So when a patient first comes to us and I see that she has a breast lump, I request for a biopsy. So a biopsy, a lot of people, they advise something called an FNAC, which is a fine needle aspiration cytology. But that is a moot point today. We do not recommend an FNAC because an FNAC uses a very thin needle. So the amount of tissue that you get to sample is very less. Instead, what we advise is something called a core needle biopsy, where a thicker needle is used. Now, when I say thicker needle, women should not get scared because, the first thing they think about, thicker the needle, lot of pain. Yeah, but that's not what happens. We give local anesthesia to the site. It's a small, incision made with a blade, and the needle goes in. So no pain at all. It goes into the lump and we take out samples. Once we take out samples, we send it to the pathology lab for it to be looked at. And they tell us, what is this? What kind of a cancer it is? And based on that, we ask for certain markers called hormone receptor markers, ER, PR, estrogen receptor, progesterone receptor. We ask for something called HER2/neu, which is a protein. And we ask for something called the Ki67, which tells us how fast are the cells dividing. So this information will tell you what is the character or the behavior of the tumor, and is it aggressive, it is less aggressive. So how I explain this to my patients, and I say this in almost every interview that I give. It's like identifying your name. So, like I ask you, okay, what's your name? Your name is Rashmi, right? Now there are 10 Rashmis. Are all the Rashmis similar? No, you're all very different. How are you all different? You have different behaviors. Your character is different. You're different people. And that's exactly the same with breast cancer as well. So if I have 10 patients of breast cancer sitting in my outpatient department, I guarantee you that each and every one of the patients will be receiving a different kind of treatment. Something would be different. One of them would have had surgery first, one would have surgery after chemotherapy. Some of them will be receiving a specific kind of chemotherapy, while another person would be receiving something very different. So, yes, treatment largely depends on the nature of the disease, what stage the patient comes to us, the size of the tumor, the size of the breast, etc.
And what are the common queries that women usually come to you with?
So the commonest query is, Doctor, why did I get this? What did I do wrong? right? And of course, I always tell them it's not that they have done something wrong, or then we have to explain that there's not one particular reason. And then we talk about, like, how in the previous episode we discussed about the causes of breast cancer. We talk about that. The second thing, which is very, very common, and they ask me, Doctor, will I be cured? Will I survive this? Then they ask me, will I lose the breast? Do I have to remove the breast? Can I avoid chemotherapy? Will I lose my hair? So these are a lot of the questions that we're usually faced with.
One of a very close family friend of mine, a very dear friend, when she had breast cancer, they removed her lymph nodes. As a result, now, although she's fine, she her uh, left hand does not drain the water. So it's always, when she started with with the process, she was told that if you do regular exercise, it will go down. But it's been so many years and I've never seen her hand go back. So this was something I never even knew, that such a thing. Even she wasn't aware. She thought that node will be removed. So is it something that it happens to everybody? Does the water draining capacity of that organ, of that part of your body, drop?
So that's a great question. Now, what people need to realize is surgery for the breast cancer does not involve just surgical treatment of the breast, of the cancer, the lump, We also need to address the regional lymph nodes. And why? Because every cancer has a mechanism by which it spreads to the other parts of the body. In the breast, the most common mechanism of spread is through the lymph nodes. So from the breast, if the woman does not catch it earlier enough, it first goes to the lymph nodes. Now we need to see other lymph nodes involved. So prior to, like, while we're diagnosing the disease, we do the biopsy and all. We also do an ultrasound, a PET CT, and also look at the lymph nodes. Are the lymph nodes involved? Okay. And if the lymph nodes are positive, like if the cancer has reached the lymph nodes, then we need to do something called an axillary nodal clearance, where at the time of breast cancer surgery, we remove all the axillary nodes. Now, in women where it looks like the axillary node may not be involved, we do a procedure called a sentinel lymph node biopsy. So by that, what we do is we use a combination of dyes. And on table, there are specific equipment we use for this, right? So the dyes used are methylene blue. There's something called technetium 99, which is a radioactive dye. So if you're using that, then we need to have like a gamma probe. And there's another dye available now, which is called the indocyanin green. So you need to have a camera which is specific for that, to detect fluorescence. So these are a combination of dyes that we inject into the breast or around the tumor. And on table, when the patient is under anesthesia, we see which are the lymph nodes that are draining it, which is the first lymph node, because then the cancer would have also drained to that first lymph node, which is the sentinel or the guard lymph node. So we biopsy that node, we take it out, send it for on-spot testing. When the surgery is going on, when the patient is on table, we do a frozen section examination of that lymph node. So the pathologist immediately cuts the node, freezes it, and tells us, does it have a cancer or not? Now, if there is no cancer, then we just, apart from those 2 or 3 nodes that we've taken out, we don't do anything else. But if it does have a cancer, then we need to clear out all the axillary lymph nodes. Okay, so that is a part of cancer treatment. You can't do anything about it. That being said, the complication that you mentioned about that your friend underwent, it's called lymphedema, right? That is when, because we are interfering with the drainage, right? Imagine a pipe, you break the pipe, or what happens, or if there's a block, what happens? After a certain point, the fluid can't stay inside, so it comes out, right? So that's exactly what's happening in this scenario. Now, it does not happen with every patient, okay? So the risk of that happening in someone who undergoes an axillary nodal clearance is 20 to 25%. But it can also happen with somebody undergoing a sentinel lymph node biopsy, and the rate of that happening is 5 to 7%. We have also seen lymphedema happening not just in the arm but also in the breast. And we've seen that it can happen with certain women who have tumors in the outer quadrants of the breast, towards the outer aspect of the breast. Okay, so these are certain factors. What we do is we always prepare for this. So we inform patients that this is a complication that can happen. So we start them on physiotherapy straight up after surgery. We tell them certain precautions to take. Like, for example, then lifelong, they should not be taking blood tests or pricking themselves, say, while gardening. Okay, they should not be overexerting the arm by lifting heavy weights. When they travel by flight, because there's a pressure difference, we ask them to wear a compression stocking. Okay, does it mean that all these measures will ensure that they will never develop lymphedema? No, but it is something that we try to sort of reduce their risk of developing that. Not everyone will develop it. Okay, to be very honest, the mechanism as to why this happens only in certain patients is still unclear. Now, more so, we think it is when the drainage of the arm lymphatics gets impaired. That's when this
You mean everything is removed from the armpit,
all the lymph nodes. So sometimes there are some lymph nodes which drain the arm. If those are affected by cancer, you have to take it out. So in such patients, the chances are more. So those who come with more advanced disease, more number of lymph nodes, larger lymph nodes, those who require radiation as well. So it's not just surgery, it's also, effects of radiation after that. These are factors which contribute to it. Okay? And we do advise that they take good care of the arm much later. So, in the sense that anything to overexert, anything that can cause a superficial infection, we request them to try and avoid it.
infection will not heal for them like a normal person.
It will heal, no problem at all. But sometimes, if there's, like, for example, they're gardening, they cut their finger. If it gets infected, there is a chance that the superficial lymphatics get affected. So when there is an inflammation, again, that is a stress on the lymphatic system, isn't it? That may cause a block. Then lymphedema may set in. Right? Now, like you said, there are exercises, there are measures, compression stockings, we have something called a lymph press. All these are measures to help reduce the lymphedema, and there are women who've managed it wonderfully. But it is not an easy task because their entire lifestyle changes around just managing that. Massaging every day, wearing the stocking, so on and so forth. Now, I think one of the positive things is there is a new technique that has come about, which is called the Lymph technique, where at the time of surgery for patients who undergo an axillary clearance, we try to connect the cut lymphatics with the venous system. So we try to create an alternate passage of drainage just in case this lymphedema happens. So I have, there are, a few centers in the West are doing it. Very, very few centers in India. I have started it last year for my patients, but we need to study it further. The preliminary evidence in literature does show some benefit, that women do benefit from this. But we still require to, study it further, which is what we are doing as well. But this is something that looks promising.
Through a mammogram, if there is any kind of a lump in the breast, you said you do a biopsy. But even if it is a non-cancerous lump, you still recommend removal, and you still have to do, plastic oncoplasty to make the breast look normal.
Now, there are younger women who come to us with lumps which may not be cancerous, Now, first of all, which is a lump that you need to biopsy or you need to. Now, women who are younger, in their 20s, they may come with multiple lumps in their breast, comes and goes. Some of them, now a lump which is increasing in size, it's not 2 centimeters, 3 centimeters, 4 centimeters, and it is increasing at a rapid rate, we do recommend a biopsy. Anything that has some suspicious features indicative of cancer on, say, the mammogram or an ultrasound, we do recommend a biopsy. Now, even if it's a benign, apart from cancers, what can you have? You can have precancerous lesions. You can have something called a phyllodes tumor. And you can have something entirely benign like a fibroadenoma. Generally, fibroadenomas, we do not advise removal.
Fibroid happens in the breast.
That's a fibroadenoma. What you're talking about, fibroid, is something that happens in the uterus. So, what are these names? It is basically alluding to the pathology of the makeup. What are the cells which make up this lesion? So a fibroadenoma in the breast is a very common condition and it's a benign lesion. We do not recommend excision. However, there are a lot of girls, younger women, who come to us with fibroadenoma that are profuse, changing the shape of the size of the breast and growing in size. Such lesions we do recommend removal. Some patients are they're very anxious. No, doctor, I want to get it removed. Then we also remove it for them. But we tell them that, do not expect, if you have complaints of breast pain or something, don't expect that removal of this lump will cure that, or don't expect that removal of the lump will ensure that no lumps come in the future, because these are all because of an interplay of hormones, right? So there is a possibility that it may come, but this is what we're doing to help you currently.
But in general, living a healthy lifestyle, even after this, to keep your hormones balanced, will help you.
Well, yes, leading a healthy lifestyle, not just for breast cancer, from a wider perspective, it does help you in terms of decreasing one's risk to develop other cancers, cardiovascular diseases. It does offer a protective effect towards decreasing one's risk to develop non-communicable diseases. Obesity is responsible for almost 13 different kinds of cancers in the body. And obesity today is a pandemic, right? Because of decreased mobility, because of increased, we eat very indiscriminately. We're always eating outside food, a lot of processed food. So a westernization of diet, westernization of lifestyles.
To end this episode, doctor, can you tell me what are the things that a woman can do for quick recovery after a surgery?
I'm not going to say after surgery. What I'll say is after breast cancer treatment. Okay? And by that, I mean, first and foremost, having a very positive outlook. Trust me, I know it's not easy, but I've noticed that attitudes make a difference. So when a woman comes all geared up and says, "No, doctor, I know you found this, but we're going to go ahead with treatment. I'm going to do this," and they take it in their stride. It's not easy. It's not easy for a woman. I mean, she has her work to deal with. She's looking after her household. She's looking after her family. But a positive mindset does help to reduce the intensity of the side effects because you're not focusing on that. Okay, but that is the mental aspect. The second thing that I would recommend for, to boost one's mental health during breast cancer treatment is those who require it, we do advise psychological counseling. Okay, and those who require it, even psychiatric medications to help with depression or anxiety to improve their compliance towards breast cancer treatment. But apart from that, we recommend exercise. We recommend an active lifestyle. So I specifically tell my patients, please don't resign from your jobs. Continue to work. We'll see how to make it work. Inform your employers that you're undergoing this treatment. You may require a few work days of break, but you don't need to stop working, because then it keeps them distracted, gives them something to do. They're not focusing on the side effects. During chemotherapy, we actively recommend daily cardio, walking, keeping active, walking 10,000 steps a day, or at least, 15 minutes in the morning, 15 minutes in the evening. We recommend yoga. We recommend breathing exercises. There is evidence. So, when I was at Tata, there was a study going on at Tata Memorial Hospital in Bombay about the effects of yoga for women undergoing chemotherapy and breast cancer treatment, and it did show a definite improvement in their quality of life, their compliance to treatment, which is what we would recommend. And post surgery, there is no increased periods of bed rest. In fact, my patients, they're walking the same day and they get discharged the next day. There are a few things that we tell them, do's and don'ts, but otherwise they're largely mobile.
Thank you, doctor. Thank you so much. And
Thank you.
I'll meet you again for another interesting discussion.
Absolutely.